COVID-19 has been responsible for millions of infections and thousands of deaths globally in 2020. Information on coronavirus and COVID-19 is constantly being updated as a result. The recent being the pronouncement by the World Health Organization that COVID-19 is now airborne. WHO has also called for more studies to investigate such instances and assess their significance to the transmission of COVID-19. That's our focus today on Sound Health. I'm Olasumbo Odukoya. Welcome to the show. We begin today's edition with COVID-19 report.
As the COVID-19 pandemic increasingly affects countries with under-resourced health infrastructure and services, it remains ethically imperative to ensure that all people in all countries of the world are able to access essential medicines. This includes those medicines that are under international control. Hence, the International Narcotics Control Board (INCB), the World Health Organization (WHO), and the United Nations Office on Drugs and Crime (UNODC) is calling on governments to ensure that the procurement and supply of controlled medicines in countries meet the needs of patients, both those who have COVID-19 and those who require internationally controlled medicines for other medical conditions. The organizations say there is a need to ensure access to controlled medicines, such as sedatives and analgesics, for intubation protocols for the treatment of patients with COVID-19. Non-COVID-19 patients continue to require controlled medicines for the management of pain and palliative care, surgical care, and anesthesia, mental health, and neurological conditions, and for the treatment of drugs use disorders. Government should ensure that sufficient quantities of internationally controlled medicines of assured quality are available and affordable to people under medical care. Governments are reminded that in acute emergencies, it is possible under the International Drug Control Conventions to utilize simplified control procedures for the export, transportation, and supply of medical products containing controlled substances, especially in those cases where the competent authorities in the importing countries may not be operating at full capacity. The General Hospital, Onitsha, Anambra State, has been included in the Nigerian Center for Disease Control Molecular Laboratory Network. There are currently 63 laboratories with the capacity to test for COVID-19 in the NCDC lab network. The Lagos State government is encouraging the public to visit or contact any of the COVID-19 sample collection center closest to get samples collected for a COVID-19 test. They are to call 08000 to schedule a test and visit a sample collection center. Sample collection and testing at all centers and public testing center is free. Nigeria now has a total of over 48,000 confirmed cases of COVID-19, more than 35,000 discharges, and above 900 deaths. Globally, more than 21 million cases and over 700,000 deaths have been recorded.
Still Sound Health on Lagos television. Recently, there have been reported outbreaks of COVID-19 in some closed settings such as restaurants, nightclubs, places of worship or places of work where people may be shouting, talking or singing. Hence, the World Health Organization pronounced that COVID-19 is now airborne. Today, Dr. Kemi Odukoya will share with us our expertise on precautionary measures to avoid contracting the virus. Dr. Kemi Odukoya is an Associate Professor of Public Health, College of Medicine, University of Lagos, and Consultant Public Health Physician, Lagos University Teaching Hospital, and she's joining us via Skype. Welcome to the show, Dr. Odukoya.
Thank you.
Dr. Odukoya, what does it take to pronounce a virus airborne?
Thank you. When you say virus or any organism for that matter is airborne, what we're trying to say is that it can remain in the air, it can remain suspended in the air, such that when someone breathes in that air, the person could become infected. And what we actually mean is that viable aspects of the organism can remain in the air long enough for somebody who is either passing by or in the vicinity of that space to be able to breathe it in and become infected. That's what we mean by being airborne.
Okay, there have been reported outbreaks of COVID-19 in some closed settings such as restaurants, nightclubs, offices or places of worship in other climes. And this means that aerosol transmission, especially in indoor locations where they are crowded and inadequately ventilated spaces where infected persons spend long periods of time with others, cannot be ruled out. Is there a degree of airborne spread of coronavirus in this case?
Okay, thank you. That's a great question. And let's go back to the basics. How exactly is coronavirus transmitted? Coronavirus is transmitted when it's from a person to person. And how does the person transmit it? By talking, coughing, in fact, sometimes even by just breathing. When an infected person is breathing out, or I mean exhaling, when the person is talking, when the person sneezes, when the person coughs, or sometimes you can have people talking very loudly. If that person is infected, what happens is that the infected particles in that area, they would come out of that individual. So what happens when those infected particles come out? They come out, and when they are heavy enough, they actually fall to the ground. Sometimes we have droplet nuclei, and those are light particles, and they remain suspended in air. And that's where this concept of airborne transmission comes in. But we need to understand that there are many factors that affect airborne transmission. And the key factor being the movement of air or ventilation in that space. So in outdoor areas where you could have those viruses or the virus particles suspended in air, because maybe it's a windy day or air is moving freely, what happens is that air is the virus in the air is dissipated away, and the people that come into that space may not get infected. However, in instances where you have closed door settings, i.e., there is no cross ventilation, the air in the environment is not moving. So you can have those particles in the air staying, and then some studies have shown that the particles can remain in the air for several hours. So they stay in the air and they're suspended in the air. And because the air is not moving, what happens is people who come within that vicinity tend to get infected. So with airborne transmission, we need to first of all know that the primary means of transmission of coronavirus is human-to-human contact, usually through droplets, sometimes a droplet nuclei, or when you have contaminated surfaces. And then in some instances, when the ventilation is poor or people are in closed indoor settings, you can have efficient airborne transmission.
Okay, most airborne diseases run their course within a few weeks. Others, like whooping cough, can last for months. Thus, this applies to COVID-19.
Well, COVID-19 is a new disease. We're just learning, and we're rapidly learning a lot about the disease. What we know about the disease as of today is that it expresses itself differently in different sets of people. Okay. So in some people, you could have a mild or an asymptomatic course, whereby the person gets infected, the virus is in there, the person may know or may not know, or may have some symptoms and may not pay attention. But the thing is that person doesn't think he's infected or doesn't know he's infected, or sometimes he just has mild symptoms that you would have in the course of everyday life. And in such instances, the virus would run its course. And there have been cases of people who they become infected and the virus did run its course and they didn't even know that they were infected. However, in some other categories of people, primarily people who are older, who have underlying diseases like diabetes or hypertension, and then in some cases men as well, because the evidence is also showing that men seem to have poorer outcomes. The disease may not necessarily run its course. Someone could get infected, and then the virus begins to cause damage. Because to cause damage to body organs and can eventually result in death.
Okay. Serious complications, weakened immune system, and longer recovery time are experienced with airborne disease. Is this applicable to COVID-19 too?
Well, we can't say for sure. Like I've said to you, the presentation of COVID-19 is variable. In some instances, you have poor outcomes. In some instances, you have very good outcomes. So it's a little difficult to put the entire virus in a basket because it tends to have different expressions in different categories of people.
Okay. One of the biggest questions we still have about COVID-19 is how much viral load is needed to cause infection.
Yeah, that's a good question. And what do we mean by how much is a viral load? Now, one thing we know about infectious disease is that the amount of the organism that an individual comes in contact with has a direct effect on the effect of that organism on an individual. So, if somebody is infected with COVID-19 or with any other respiratory tract infection, and the person is in close proximity to another person, and then the person now decides to cough, sneeze, and then he's doing it repeatedly. So somebody else who is in that space is inhaling the virus and also inhaling it repeatedly. So what happens is that person is exposed to a higher dose or a higher concentration of the virus than someone who may just be casually walking by. There were some viruses suspended in the air, and the person just passed by, inhaled a little bit of it, and then moved away. So we do know that, and that's the reason why we emphasize physical distancing. We emphasize physical distancing because we believe that even when the virus is suspended in the air, there's only so far that the virus can travel, and we believe that if you are not in the vicinity of an infected person for a long period of time, it is possible that the person may not be exposed to a large enough concentration of the virus to cause severe illness.
Okay. Although it is impossible to completely avoid airborne pathogens, what can be done to prevent spreading an airborne disease?
Well, I said before that for coronavirus, what we know is that ventilation and the movement of air plays a significant role. Mm-hmm. So in times like this, what do we advise people to do? Try to avoid staying crowded indoor spaces. Because if one person in that crowded indoor space has the coronavirus, and simply by talking, that person could express the coronavirus into the air, and then because the environment is closed, because the air is not moving out, because you don't have cross ventilation, those viral particles could be suspended in the air for long periods of time and affect other people. So as much as possible, when you can be outdoors, it's better to be outdoors. Avoid closed indoor spaces. Avoid small gatherings whereby they are all indoors with the air conditioners on, and things like that. And more importantly, give enough distance between you and the next person.
Okay, now that the virus is airborne, are there different or additional precautionary measures that must be followed?
Well, what we've been saying before is what we were saying was that people should maintain physical and social distancing, and we realize that also applies to airborne. I think airborne transmission, the only thing I would say that maybe we might want to emphasize a bit more is the avoidance of being in closed indoor spaces without adequate ventilation, because people who are mildly symptomatic or even symptomatic, might express the viruses in the air, and when others are in those spaces, they could become infected.
Okay. The new norm in the society is the use of mask, but from survey you would realize that most people have devised different means to suit their styles with the use of face shields and all kinds of masks at the expense of their safety. What's your take on this, and what advice do you have for members of the public?
Well, one thing we know is that masks protect others from being infected. So we will have a very good population effect for the control of this virus when everybody is wearing the masks. So let's remember that when we wear masks, we're not only wearing it for ourselves, we're wearing it for others in the environment, particularly the vulnerable people in their environment. So what we would just say is we would encourage people. We know that many people are not comfortable wearing masks for some reason or the other, but we do know that wearing masks protects others, and having that in mind might help people be more compliant to mask wearing.
Okay, thank you so much, Dr. Kemi Odukoya, for your time and expertise on Soundhealth.
Yo.
And I must commend you and other frontliners on your efforts so far to curtail or beat COVID-19.
We're thankful to God.
Okay,
it's a pleasure.
I have been talking to Dr. Kemi Odukoya, an Associate Professor of Public Health, College of Medicine, University of Lagos, and Consultant Public Health Physician, Lagos University Teaching Hospital via Skype. Sound Health continues in a moment with trending health reports. Please stay tuned. This is where we drop the anchor on today's edition of Sound Health. Whatever you do, adhere strictly to all precautionary measures to beat COVID-19. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social #SoundHealth. A sound health is a sound mind. Make healthy living your choice.